Hello, Gold viewers. I'm Fiona Lang Sharp, IBCLC and Public Relations Manager and MC for Gold Perinatal Online Conference 2015. Welcome to my interview with Karen Strange. Karen, it's great to have you back. How are you?
I'm good. It's nice to be back, Fiona. Thank you.
Oh, I tell you, I know you can't see me and neither can our listening audience, but I'm kind of grinning from ear to ear because that's the type of feeling I have when you're here is that I'm just grinning. So it's good to have you back. Thank you.
Well, thank you. I have all sorts of tingly oxytocin running through me after you said that.
Oh, that's perfect. That's perfect. Now, for our listening audience, I want to let you know that Karen's going to be presenting on this presentation, Meconium, Facts, Implications, Perspective, and Understanding. Now, to me, Karen, that just sounds like a really big topic. And so I know that you probably have a lot to say about it, but I want to know, like, how important is this subject to you?
Well, Fiona, thanks for asking. It's been one of those conundrums for me because I experienced a severe meconium aspiration baby when I was training, and I really decided I had to know more and understand how it happened and why it happened and how to prevent it. And that's really what this is. This is the continuation of trying to figure out what this is because, as you know, it's a big deal in the hospital. And there's a lot of misunderstanding about how to prevent it.
Right, absolutely. And just before we came online with our audience, you and I were just chatting, and I was expressing, some of my angst at being at births and some of the things that go on, in that moment. And I feel like there could be some discrepancies. So let me ask you, do you feel that there are inconsistencies in practice today? And why do you believe that this is happening?
So, yes, I do think there are inconsistencies. And again, as I try to do in most of my lectures, I try to make them evidence-based and to look at the studies around meconium, why it happens, and how to prevent it. And when you look at the studies and the interventions that are used to prevent meconium aspiration syndrome from happening, they don't line up. And there is some change in guidelines that are set forth, but they seem to be much slower than the evidence-based studies that are actually published and out there about these interventions. So they don't line up. And that's really, I want to bring some understanding to what the studies are, what is actually happening, and then what you can do or what to be aware of. So I think that kind of answers that.
Sure. Yeah, absolutely. Well, that's interesting. What you're saying is that really we're sort of at a mismatch of, in this practice right now as far as the research versus, the procedures that we have, and it's taking time. It's not lining up and it's slow. So I'm hoping that, one of the things that this will do, as I was thinking about it, and as you're responding there, I'm hoping that this propels some things forward in terms of, as terms of practice and opens people up to this conversation again. But I want to know from you, what are you most looking forward to in teaching the delegates about this topic?
Well, my real interest is for them to understand what is happening when you see meconium. What does that mean? What is actually happening? Why is it there? And then to understand not only the evidence-based studies and the guidelines, but how our standards, how the standards are slowly, just as you said, Fiona, slowly evolving to begin to reflect the evidence-based studies, which then in turn affect the guidelines. So mostly I really want to open up the subject of meconium because there's a lot of misunderstanding around meconium. Why it happens, how it happens, what's happening for the baby, what does it mean, when is it not a problem, as such.
Excellent. Well, that sounds fast. That sounds really good. I mean, I think that in terms of meconium, it's something that I feel like is taught early on in practice, but yet
Mm.
they're just, it sort of has, dissipated in conversation. It just isn't talked about very much. And so I would understand that maybe the practice is stale because there is new research. And, we need to be on top of those things as we've learned more and we have more parameters to understand why it happens and all those things. Well, Karen, thank you so much. I really appreciate the conversation. It's great to hear that. And for our delegates listening in right now to this little sneak peek of what's happening at our Gold Perinatal Conference, Meconium, Facts, Implications, Perspective, and Understanding by Karen Strange. Don't miss out. Make sure you're there, and we'll look forward to seeing you at the Gold Perinatal Online Conference 2015. Thank you again, Karen Strange. It's been a pleasure having you here today.
Thank you, Fiona. I'll see you next month.
Sounds good. Thanks, everyone, and have a great rest of your day.